Hi people, can you all hear me? Hi people. Okay, let's start. I hope my screen is properly visible to you all. So today we'll be solving the sample mock test 6 that I had released, and after a couple of days we'll be solving the endo mock test as well, but just a few questions of endo mock test, not everything, because it has 40 questions. But let's completely finish this mock 6 quickly. I have to leave for my clinic as well after 40 minutes. So I hope your preparation is going fine, and most of you who want to appear for the March 2023 exam have registered and paid for the exam, right? Hi Hamda, hi Vartika. Good to see you all. So let's start. The first question. Uh, a 48-year-old female presents at your clinic requesting you to replace her lower partial denture and acrylic one. All right. Which was made 10 years ago. So when this word comes 10 years ago, it means that it has been worn very nicely since the past 10 years. The patient is pretty much used to it, and the denture has done its job, and probably a replacement is on the cards, okay? But now has become loose and unstable, which is understandable because it's been 10 years. So what will happen? The denture has been given, so the bone resorption must be happening, correct? Now, clinical examination reveals she is bilaterally edentulous. Bilaterally edentulous distal to the lower premolars, meaning after both the premolars there are no teeth. So come on guys, even before I ask you the other question, which Kennedy's classification is this? Answer me. Come on, Hamda, Vartika, Abir, Sunita. Answer me. Which Kennedy's classification is this? Bilateral teeth missing after the first premolar. Class 1, Class 2, Class 3, Class 4 Kennedy's. I'm waiting for your answer, guys. This should be on your fingertips. Yes, Kritisha, very good. Kennedy's Class 1. Now, she has an intact upper dentition. Her medical history reveals post-operative bleeding problems and hypertension. So, upper dentition is intact, meaning upper teeth are all natural. Medical history, okay, bleeding problems and hypertension. Okay, now let's proceed. So now we have a gist as to what this patient has, a rough overview. Now, what is considered to be major factor in residual ridge resorption? Very good question. Let's read the question again. What is considered to be a major factor? So this question is not only asking you the factors in residual ridge resorption, it is asking you a major factor. Now, when you get such a question, you should understand when an adjective like major is added, that all the options that would be given to you will be correct, all of them, and you have to choose the major, that is the most priority option from it. You understand? So it's me like asking you who's the most important member in your family, and the options are mother, father, brother, grandfather, grandmother. So all the options are correct. Now, major factor, as in the major person responsible, who's that person? So then you have to think. You understand? So don't go with the assumption that only one answer will be right. All of them. That means it's a very confusing question. Are you getting my point? So, from now on, when you read any other question, and if you find an adjective like this, which is the best option, which is the initial test you will do, that means all the options given will be correct. So, priority has to be decided. So, okay, let's see the options. Occlusal forces, it's a correct answer. Bone density is also a correct answer. Medical history positive for osteoporosis is also correct answer, and ill-fitting prosthesis is also correct answer. All of these will cause residual ridge resorption, but which is the major factor? Because it's a distal extension case, the most important thing that will stress the ridge, apart from an ill-fitting prosthesis, would be occlusal forces. I'll be very confused between ill-fitting prosthesis and occlusal forces. But if I have to choose a major factor, I'll go with the occlusal forces. Understood? Because even if it's an ill-fitting prosthesis, and say you're not chewing properly, then it will not cause residual ridge resorption. But if the prosthesis is good and the occlusal forces are there, then it will cause residual ridge resorption. So I hope you all understood why I'm choosing occlusal forces over ill-fitting prosthesis. Got it? So let's move ahead. Which Kennedy classification this case is? Now, for some reason, this particular candidate has chosen 2, whereas we have all agreed that it's class 1. So, silly mistake, you should not commit such a silly mistake. You decided to provide a rigid direct retainer assembly. Which material would you select? Now, see, by default in prosto, when a partial denture case comes, the first option is a cobalt chromium cast partial denture because that has the best fit. Next comes acrylic. So I understand at a BDS level, nobody has given a cobalt chromium partial denture, so we don't give it much importance. But in the rest of the world, especially in Australia, a cobalt chromium is way preferred than a simple acrylic because cobalt chromium, you can manufacture it to be more sturdy, it can be thin, it has better retention and fit, it decreases the stress in the abutments. So always the answer, first option should be cobalt chromium. If that is not given, then you go with acrylic. Now you prefer to incorporate the RPI. See, RPI question will always be asked in the exam, okay? Must study the components of RPI. That is rest. It is always a mesial rest, never a distal rest, okay? It's always a mesial rest. It's always a mesial proximal plate and an I bar. I bar is the one which goes near the gingiva. I hope you are aware of how the design looks like. So that I bar, this is not permanently attached to the abutment tooth. When you bite, it goes down, like it releases the stress and it transfers it to the ridge and not the tooth. So that's why it is a stress relieving and it's preferred, it's aesthetically pleasing as well. So why have I selected this? Because is it going to increase my retention? I wouldn't say increase, it's a good retentive thing. Decreases stress on abutment? Yeah, I just gave this answer in my explanation. More comfort to the patient, that is also true. Facilitates lab procedure doesn't matter. You give RPA or a cast partial denture. But I'm giving it because I want to decrease the stress on the abutment. Like, of course, I'm bothered about the comfort of the patient, but I'm also have to look forward to the tooth that it should not take too much stress because it's a distal extension case, meaning it is tooth and tissue supported, not just teeth supported. I hope by now you understand tooth and tissue supported. That means after the tooth, the tissues, the distal tissues are the one which is going to give you the stability because there is no posterior teeth. Understood? So my main aim is to not let the premolar, which is the last tooth on which I'm going to give the support, become loose. So I want to decrease the stress on it, hence RPI system. Is this clear? Now, which of the following is considered the least favorable choice of retainer in a distal extension removable partial denture? Now, when I say least favorable, again there is an adjective, meaning all the options can be correct, out of which I have to choose the least favorable. Understood? So it's like me asking you which is your favorite food, or rather, which is the least favorable favorite food. And I give you 4 options. So all of them will be like least favorable in your list, but one of them will be really horrible. So let's go to that. Acres clasp. What is an acres clasp, guys? Go Google. I-bar. I-bar is the gingival one which I was speaking about. Embrasure clasp. Now, embrasure clasp is between 2 teeth. Do you want me to show you on Google how it looks? Let me show you an embrasure clasp. This is how an embrasure clasp looks like. It's a very beautiful retention method, by the way. So it goes in the embrasure, that is the dental area between the two teeth, and there is rest on both the teeth, and this is how the assembly goes. It's a very solid form of support. So this is kind of a good clasp. Okay, what is Akers clasp? Let's see what is Akers clasp. So I would prefer this clasp actually. It is not my least favorable option. Akers clasp. This is a normal 3/4 clasp that we give circlet. Normally we give this, the most commonly used clasp, this is one. Is I bar always preferred in distal extension? Most of the time, 99% yes, Vartika, it is preferred. So this is an Akers clasp. Now what happens with this clasp is that it will rotate the tooth, by frequent forces, and this is fixed on the tooth. So eventually what will happen is the tooth can become loose, or most often it's given on the most posterior tooth like this. Can you see this design out here? So Akers clasp is here, but in our case it is distal extension case. So it is not my preferable choice. So I will put this in my least favorable choices, but let's see the other options as well. So this is one of the not favorable clasp for the distal extension. So I bar is a favorable, so I will remove that from my option. Embrasure is also favorable. Now wrought wire clasp. Wrought wire is a very thin wire. It will just break. Wrought wire is, for example, in your ortho postings, you remember that 22 gauge wire, like very thin, you can just bend it anyhow. That is your wrought wire clasp. Understood? So that you will definitely not give, because that will not give any support, and in fact it will just twist and break. This wrought wire you usually give on the chair side, like a patient came and he broke the clasp and you want to fix it immediately. So what you will do, you will just take that 22 gauge thin wire, you will bend it in a C shape, you'll put on the denture, you'll put some acrylic and immediately fix it. It's a temporary fixed solution, you understand? So you will never give this as a permanent kind of a retainer. So amongst the least favorable option, this becomes my answer. Now, even if you did not know about Akers clasp or I-bar or embrasure clasp, just remember wrought wire is a temporary fixing solution. So even if you had zero knowledge about the three clasp, still you can figure out the answer by knowing about the wrought wire. Understood? Is embrasure clasp is for class 2 and 3? Actually, you can give it for 1, 2 and 3, 4, all of them. It depends on the design. It's a really good clasp actually, because it doesn't occupy much space and takes support from two teeth. Now coming to second scenario. A 60-year-old male patient comes to your clinic complaining that his lower teeth are loose and painful. Okay, so they are loose, perio issue probably, and painful also. Upper arch is edentulous completely. The lower anteriors are present, which have grade 3 mobility. He requests for a lower denture. So lower teeth are loose and painful, and they have grade 3 mobility, and he's asking for a denture. So the first thing is that you'll have to get rid of the teeth. You both agreed on extraction of the mobile teeth and replacement with an immediate denture. Now, when the question is telling you, you have agreed to replace with an immediate denture. Guys, what is an immediate denture? Immediate denture is the one which you give immediately after the extraction. It helps to heal the area and preserve the blood clot. But once the healing has taken place, the measurement of the denture will not match the ridge, because the ridge has healed and the denture is no longer going to fit. An immediate denture will last maximum for 2 weeks, not more than that. So with the immediate denture, you always have to tell the patient that you will be coming back to get a new denture, because this immediate denture was a temporary one and it will need a replacement. Understood? So once you are understanding this concept, the questions will be easy. So now the first thing, patient came to me, he says my front teeth are mobile and I have pain and I want a denture. So what is the first step that I will do? I'll take an X-ray. I can also do a pulp vitality test though. I know there was a question in which the pulp vitality was also an answer. And here we have given OPG as an answer. Now see, in that question, the other one, I don't think so we had mentioned that we are proceeding with the denture or something. Here the question says we are proceeding with an immediate denture. So I just need to know completely if there is something else in the bone which is going to give me a trouble later on, because I'm going to give the denture spot on. So, though vitality also becomes an option, because I would like to know if the teeth are non-vital or not, but still, preferred option here comes to OPG because of the framing of the question. Don't confuse it with another question where vitality was the answer. Okay. Full mouth PA views is not wrong exactly, but when OPG is there, I rather choose it. Percussion, you can do it, but it's not like most important right now. And trans-elimination, well, caries doesn't matter to us, so trans-elimination is out of question. Now you decided on lower anterior teeth extraction and immediate denture placement. What kind of consent is required? Always a written consent. Verbal consent is good for you to start, but for record purposes, you will always need a written consent. And this you follow it in your clinical practice as well, you know. Don't underestimate. You never know what happens when what happens. So, written consent is mandatory every time for everything. Even take it for a filling procedure, you know, we do it for the filling procedure as well. If you decide to give acrylic denture, what is the advantage of acrylic over cobalt chromium? See, the only advantage of the acrylic denture is that you can always add a tooth very easily, which you cannot do in cobalt chromium. That is it. There is no other advantage. Greater retention is advantage of cobalt chromium. Greater thermal conductivity, again, acrylic, you cannot feel any temperature, but with cobalt chromium, it's a metal, so you can. Strength, cobalt chromium, any day. Lighter in weight, well, acrylic is a bit lighter in weight, but so can be cobalt chromium, you know, depending on the design. But can be repaired and teeth can be added on easily, that is the main advantage. Understanding my point? Scaling and polishing needs verbal or written consent. You should take a written consent. I'll tell you why, because you know, some people have some heart conditions or some bleeding disorders, and they may or may not tell you, and while you are scaling, you will come to know about it. So you should not be in a jeopardy. So might as well on the form write that the patient has informed that they don't have anything, or if they have any medical condition, mention that. So see, consent forms are basically to safeguard you, not the patient, because not all patients will always tell you the truth. So you have to safeguard yourself, because if you have not taken a consent and something happens, then you will be questioned and patient can always deny. You understand? So always consider as if the patients are not telling you the complete truth, and that's why the consent becomes very important to safeguard yourself. Now, what impression material will you use in order to produce impression for the diagnostic cast? What is the important word here? Diagnostic cast. Now, if I would have said final cast, then either ZUE or you know, the light body PVS impression putty becomes the answer. For diagnostic cast, I will always go with alginate. There are many people who have also answered impression plaster. See, impression plaster is to pour the impression. But if I have to make an impression in the patient's mouth, I will not use an impression plaster. I will use alginate, correct? Getting my point? So if I would have said final impression, then ZOE or PVS. If I'm saying a diagnostic cast, it's alginate always. Now, after immediate denture insertion, what should the patient expect? Now, what did we discuss in the start? He will need a metallic based denture. I don't know why this candidate has chosen this answer. It's wrong. Nothing, the denture will last for life. No, it will not last for life. Denture will help healing in the socket to an extent, yes. He will need a new denture or relining. That is more correct. See, C option is also correct. Denture will definitely help in healing the socket. But he will need a new denture or a lining that the patient should expect. But these teeth are mobile. We can't use alginate for mobile teeth. You can actually. Oh, I have done alginate impressions on mobile teeth. The trick is to remove it before it's completely set. See, you cannot use a putty. Putty will definitely take the teeth out. You cannot use poly either. It's very expensive. Impression plaster is for pouring. So out of the options that's given to you, alternate only becomes the option, right? You will not take an impression with ZOE, right, Shruti? So alginate, in fact, we take alginate impressions. When I do ortho cases, we also take impressions with alginate, even though the brackets are there, because it has good setting thing, and just before it sets, you just remove it. So it kind of gives you a good impression. Putty will get stuck like crazy on the undercuts and everything. It will remove everything. So putty doesn't become the answer of choice. In fact, you should not use it. Polyether you cannot use, PVS is putty, and ZOE you will not use, impression plaster you cannot use. So even if you don't like alginate, you still left with that same option. Understood? So yeah, after immediate denture insertion, the patient should expect a new denture later on. Now coming to the last question. A 64-year-old female article say, wait, let's go back to this. Shruti is saying articles say alginate would lead to extraction of mobile teeth. See, if you let the alginate set completely, it may or may not result. It's not 100% surety that it will lead to extraction of mobile teeth. But amongst the given options, alginate is your safe bet, because the rest of them surely will create a problem. 100%. Alginate not 100%. And it says grade 3 mobile. It's not like it's so wobbly that, just you can pluck it out. So amongst the given options, I would still go with alginate. Understood? But you don't use putty ever. Remember this, okay? Alright, let's go to the SBQ3. A 64-year-old female presents to your all old patients in this mock test, all of them old. A 64-year-old female presents to your clinic complaining that recently she has a gagging reflex. Whenever you say gagging, your idea should go to the post-dam area. Once she inserts her upper complete denture, which was constructed just 2 months ago. So it's been 2 months. The denture was fine for the first week. So that means there is a problem in that post-dam area, but not so severe. So other problem options can also be there, because she's coming to you after 2 months. If there was a severe problem, she would have come to you like within the first week itself. Now, the patient medical history showed that they have uncontrolled hypertensive and diabetic patient. See, when the patient mentions, now there is the question mentions that there is uncontrolled hypertensive and diabetic. It means that the patient is taking some medications. Now, when the patient is taking some medications, the first thing that you should expect the question, one of the question to be is that it is going to cause problem with the saliva. Correct? So xerostomy or something like this will be caused. So this should be at the back of your mind when you read this question. Even though some question like this may or may not be asked in the subsequent SBQs, but you should have this thing in your mind. So let's start reading the question. Which denture fault could cause a gagging reflex? Now, this question, which denture faultiness could cause a gagging reflex, it's not related to this question at all. This is a basic dental question. They have just introduced this. So this is not based on the scenario. So you have to use your basic dental knowledge. Flappy tissue to an extent under extension borders will not cause gagging. It will make the denture fall off. Dehydration of the tissue again will cause a problem in retention but not gagging. Posterior teeth set end to end will cause rocking of the denture and the denture will become loose, but it will still not cause gagging. So what can cause gagging is overextension. Now when this says faulty post-dam, it can be underextended or overextended, but we'll go with the overextended option. So faulty post-dam, that should be the answer. Understood? See, complete denture is not tough if you start utilizing your logic. I know a lot of people are confused in complete denture, CPD, RPD. But you saw today we are solving just the CPD, RPD questions. And even if you did not know the answers, we could still reach the correct answer by elimination. So don't be afraid if questions like these are asked in the exam and you feel, oh my God, this is prosto now, how will I attempt it? Just be very calm. read the question, understand the question, then read the option, and you will reach the right answer by using your basic dental knowledge, you know. Now, if you would have seen these questions and now you go on to solve, I'm sure you will attempt everything correctly. Are you getting my point? Now, when you checked the denture post dam, it was okay. So, what could be the reason then? Nice question. So you checked and you saw that the post dam area was properly made. It was not under or overextended. So why the patient is still gagging? Now let's just think why the patient can gag. One reason can be overextended, but we ruled it out. What is the other reason? See, when the upper and the lower denture are made, and if the occlusion is not proper, or there is some problem in the ways you have adjusted the occlusion, or increased vertical dimension, when the patient closes the mouth or chews, the denture will rock. When the denture will rock, that means the seal will be broken somewhere. Now, when the seal gets broken, saliva seeps inside. And when that happens, the denture becomes loose and it falls off. Or you will gag. Understood? So, what I need you all to do is to read mistakes in denture delivery. There will be nice PPTs present over Google, over SlideShare. Just type problems in denture delivery, faults in complete denture, and just go through it once or twice with logic. Don't mug up. It's very easy to remember. So let's come to this question. So what could be the reason then? So, and you checked that the post dam was okay. Overextended posterior border, but we just checked it was okay, so that is not the answer. Malocclusion, I just explained, can be an answer. Increased vertical dimension can also be an answer. Flappy tissue. Flappy tissue cannot be an answer. So I'll be confused between malocclusion and increased vertical dimension. Correct? So now when I'm confused like this, my highest priority will be going to the malocclusion. Because nowhere in the question they said that the patient was having pain while wearing the denture on biting. Because when there is an option of increased vertical dimension, the question will mention that as the day progresses, the patient feels lot of pain because the muscles are getting stretched. And this is one of the SBQs, I think, in my first mock test, which I had shared. So because this question has not mentioned that, I will go with malocclusion. If the question had mentioned that the patient had pain which progressed during the day, then I would have chosen my answer as increased vertical dimension. So now the main question becomes important to me. So I will go back to that question, read it, and then solve this answer. Understood? With me, guys? Side effect of antihypertensive include all of the following except. Now, see, when you get exhausted in the exam, you commit a silly mistake like this candidate has committed. This is asking you all of them are side effect except increased gag reflex is not a side effect of any antihypertensive medicine. Xerostomia is a side effect, and this candidate has chosen this answer. I'm sure in her mind she must be thinking, xerostomia is caused, and let me choose this answer. But what is the question asking? It's asking all of them can be the side effect except lichenoid reaction, neutropenia, none of the above. So, increased gag reflex cannot be the answer. Xerostomia is a side effect. Understood? Don't commit the same silly mistake this candidate committed. Read the question again and again, especially the question which mentions except, in spite of, all of the following are wrong, except, all of the only one is true. So, simple, silly mistakes like this can cost you your exam. I hope you understand. Now, possible complication of the uncontrolled diabetes includes all of the following except again, which means that all of the following mentioned will be possible complication and one of them will not be a complication. This is how you read the question. One of them is not a complication. So you keep on repeating in your mind like this. Impaired wound healing, is that a complication? Yes, it's a complication. So I will not choose that answer. Retinopathy, is that a complication? Yes, it's a complication. End stage renal failure in uncontrolled diabetes, is that a complication? Yes. Stroke, is that a complication? Yes. Hypertension, is that a complication? No. So that's why it becomes my answer. So whenever you read a question like this, except you repeat with every option like this. This can be a complication. This can be a complication. So what is not a complication? That is my answer because that is what the question is asking. Understanding this, see, right now we are just solving 3 questions, but in the exam, when you will have 70 questions and you will be the end of your questions, you will be mentally exhausted. At that time, you will need to know the step of revising in your mind because your exhaustion should not be the reason why you flunked the exam. Understood? What is the short and long term treatment for this patient? Now, what is the question saying this patient? That means this scenario based question. Short and long term both. For short and long term, provide a better denture design. See, this is kind of a correct answer, but let's see the other options. For long term, treat the gingivitis and make sure that the supporting tissues are in good condition. For short term, reset the teeth. Not a bad option either. For long term, make sure her underlying systemic disease are controlled. The diabetes is uncontrolled here, which is a major problem. For short term, remount the denture and grind because what is happening here? Gag reflex is happening. So, and what was the problem? Malocclusion. So, if I grind the teeth and adjust the malocclusion, then probably my short term thing will be controlled. For short term, start systemic oral hygiene instructions. For long term, make a new denture. That is also kind of correct. Change the denture base material. That is not an option. My denture does not have a fault. It's just the malocclusion which is causing the problem. So, out of all these options, C option sounds more logical, and that's why we go more with it. So yeah, that's how it is. So now you see where all you can make a silly mistake, and now when you read the questions again, you'll be like, yes, I know all this. I have studied this in my dentistry. Yet I'm attempting this wrong. Why? Practice. Revision in the mind. And practice can only come when you solve again and again the mocks. Understood? So I would again advise you all, recommend you all to solve as many mocks as possible, multiple times, time yourself, see where you made a mistake, why you made a mistake. This is how you prepare for the exam. So that's about it, guys. I'll just get ready quickly and leave. If you have any questions, leave it in the comment section or just WhatsApp on the groups that you are, and I'll be happy to answer. Sooner, like next week, basically, I'll be taking the endo mock test. Can I get my score? You want your score for this part 6, I mean mock 6, or you want for the endo? Shruti. Okay, let's check for your sample mock 6 your score. What was your email ID? Shruti. Okay, let's search you. Where are you? I can't find you. Where are you? Did you submit by the same email ID? It's gone. Oh, yeah, I got it. You got 13 on 15. Where did you make a mistake, Shruti? You made mistake in fitting prosthesis, and what impression material would you use? You chose putty. With putty, surely the teeth will come out, Shruti. So, anyways, good work, Shruti. Nice. So, all right. Kritisha, how much you scored? Kritisha wants her score. Okay, let me quickly search before I have to make a dash now. Where is Kritisha? K. Yeah, here. Kritisha, you scored 9. You need to practice, my dear. You had the first option, the Rottweiler wrong. Then you had the Kritisha, always a written consent, never a verbal consent. None of the above is wrong. Then post-dam. Darling, we just discussed. We checked the post-dam area was okay. Still, you have chosen overextended posterior border. This is the trap. Don't fall for it. Dentist Emmy Fadi, tell me my score, please. Tell me your email address, then I can tell you your score. Kritisha, you need to practice a lot. You made a lot of silly mistakes, dear. Emmy Fadi, quickly tell me your email. I will search. Okay, I cannot see your email here, so I'm going to let this be now. So have a nice day, guys. See you all in the next session. And I will end this Facebook Live now.